If you're dealing with osteoarthritis, you know that relentless, grinding pain that just doesn't seem to quit. Well, today we're going to talk about something that might just be a new path forward for you. It's a treatment that's been a go-to in Europe for decades, and it's called low-dose radiation therapy.
When you live with chronic pain, it can feel like you're just stuck. You've tried all the standard stuff, right? The pills, the injections, the physical therapy, and when none of it really works, it's easy to feel like you've hit a dead end. It is an incredibly frustrating place to be.
But what if I told you there was another option on the table? Something non-invasive, something with a long track record that could seriously dial down your symptoms and just give you your life back. Let's take a look.
All right, so let's get right into it. First things first, what in the world is low-dose radiation therapy, or as we'll call it, LDRT? It's actually pretty straightforward. LDRT uses a very, very small and precisely controlled dose of X-ray energy that's aimed directly at your painful joint. Now, the key words here, the ones you really want to remember, are safe and low dose. The whole point is to gently reduce that pain, stiffness, and swelling that's been causing you so much trouble. So, how does a little bit of radiation actually accomplish this? Well, think of it like this. It sets off a calming chain reaction. First, that low dose of energy is targeted with pinpoint accuracy right at the joint. That energy then tells the inflamed lining of your joint to just settle down. This, in turn, reduces the activity of the very cells that are causing all the trouble. And the result? You break that vicious cycle of pain and swelling. Okay, this is super important because we need to have realistic expectations. LDRT is a fantastic tool for managing your symptoms. It's great at reducing inflammation, managing pain, and really improving your day-to-day quality of life. But it's also important to know what it can't do. It is not a cure for arthritis. It won't regrow your cartilage or reverse damage that's already been done. The goal here is relief and getting you moving better.
So, you might be thinking, okay, this sounds interesting, but what does the process actually look like? What would I go through? Let's walk through the entire journey from start to finish. It all starts with a planning session. And let me tell you, they are meticulous about this. First, they get you into a comfortable position on a table, sometimes using special cushions to get it just right. Then, they take an image, like a CT scan, to create a perfect 3D map of your joint. This lets them put a few tiny, temporary marks on your skin to make sure that every single treatment is aimed at the exact same spot. It's all about precision. And the treatment sessions themselves, they're almost boring in the best way possible. You just lie down in that same comfy position, a machine quietly moves around you, it never even touches you, and that's it. The radiation is totally invisible and silent, you feel absolutely nothing. And get this, each session is only about 15 to 20 minutes long. Afterwards, you just get up and go about your day. No downtime at all. All right, the process sounds easy enough. But now for the million-dollar questions, right? Does it actually work? How long does it take to feel better? And what about side effects? Let's get into it.
This is the number that really matters. The data shows that a big majority of people, we're talking about 70%, so 7 out of 10 patients, get meaningful pain relief from LDRT. For people who felt like they were out of options, that's a huge, huge deal. Now, the relief isn't like flipping a switch. It's a gradual process. You might start to notice things getting a little better in the first few weeks, but for most people, the maximum benefit, that real aha moment, happens somewhere between 1 and 3 months after treatment. And the best part, that relief can be really long-lasting, sticking around for many months and sometimes even years. Okay, but what about the side effects? Take a look at this number. Less than 1%. Fewer than 1 in 100 patients have any noticeable side effects at all. That figure is just incredible, and it really shows you how gentle this therapy is.
And in those super rare cases where side effects do pop up, they're usually very mild. We're talking about things like a temporary little increase in pain, what they call a pain flare, or maybe some mild fatigue, or a little bit of skin redness. But honestly, the main takeaway here is right at the bottom. Most people experience no side effects whatsoever. Of course, anytime you hear the word radiation, the first question on everyone's mind is about safety. And that's a fair question, so let's tackle that concern head on. This comparison right here is the key to understanding everything. Comparing the radiation in LDRT to cancer therapy is, well, it's like comparing a garden hose to a fire hydrant. The dose for cancer therapy is significantly higher because its goal is to destroy cancer cells.
LDRT is totally different. The dose is substantially lower, and the goal isn't to destroy anything, it's just to gently calm inflammation. That means the risk profile is incredibly small.
And look, this isn't just a guess. This is based on decades of experience in Europe where they've treated tens of thousands of patients. The bottom line from all that real-world evidence is that the risk is considered so small, it just hasn't even been seen in clinical practice. That's a really powerful statement.
So we've gone through what LDRT is, how it works, what to expect, and just how safe it is. Now for the final and most important question, what does all this mean for you? Let's just boil it all down one last time. We're talking about a proven, non-invasive option for osteoarthritis pain. It works for most people, about 7 out of 10. The process is quick, it's painless, and there's no downtime. Side effects are almost non-existent, and it's considered very, very safe, using a tiny fraction of the dose used in cancer therapy. So if you've been feeling like you're at the end of your rope with osteoarthritis pain, maybe this is it. Maybe this is the conversation starter you've been looking for. Is it time to ask your doctor if LDRT could open up a new road for you?